Hello everyone, welcome to my channel. It's InfoTuber. In today's video, I'm going to explain about the bone clavicle. So, the clavicle is the upper limb bone. Upper limb have 64 bones where 32 bones are present on each side. In my previous video, I have given the introduction on the osteology where I have explained about the number and the names of the bone. You can check it in my description box. I have left a link below. So, let us come to the bone clavicle. Clavicle mainly have a shaft, medial end and lateral end. So each and every bones are studied under two categories. They are the features and attachments. Okay. So let us come to the features of the clavicle. Shaft. Shaft again have two parts. They are the medial 2/3 and lateral 1/3. Medial 2/3 is convex forward and lateral 1/3 is concave forward. You can see here medial 2/3 is convex forward and lateral 1/3 is concave forward. And again medial 2/3 have the four surfaces. They are anterior surface, posterior surface, superior surface and inferior surface. Next, lateral 1/3 have two border and two surfaces. Anterior border, posterior border, superior surface and inferior surface. Inferior surface have a small elevation. It is called as a conoid tubercle. So previously I have said that the medial end articulates with the body of the sternum which forms sternoclavicular joint, and the lateral end articulates with the acromion process of the scapula which forms acromioclavicular joint. Now let us come to the attachments of the medial 2/3 of the shaft. Medial 2/3 we know it have a four surfaces. The posterior surface give attachment to the sternohyoid muscle and superior surface give attachment to the sternocleidomastoid and anterior surface give attachment to the pectoralis major and finally inferior surface give attachment to the costoclavicular ligament. Next, let us come to the lateral end of the shaft. Lateral end of the shaft, we know that it have two borders and two surfaces. First, the anterior border give attachment to the deltoid muscle and posterior border give attachment to the trapezius muscle. And finally, in inferior surface, we know that we have a conoid tubercle. At this tubercle, there is an attachment of the coracoclavicular ligament. We have completed the features and the attachments of the bone clavicle. Now, I will tell one clinical anatomy where the clavicle is commonly fractured by falling on outstretched hand. The common site of the fracture is a junction between the two curvature of the bone here. This is the common site of the fracture. Speciality of the bone clavicle is this is the subcutaneous large bone lies horizontal. It's the first bone to start ossifying and ossifying the membrane without a medial cavity, and this is the only bone which have a two primary center of ossification and one secondary center of ossification. So this is the short video about the clavicle. This video is only for the revision purpose and for the quick view on the bone. So I recommend you to study the bone in your textbook deeply. In my next video, I am going to explain about bone scapula. So thank you for watching. See you in my next video. Bye bye.